marks the start of Brain Awareness Week. So in today's checklist, we are talking about some key reminders and the latest advances. Dr. Carolyn Brockington is a vascular neurologist and the director of the Stroke Center at Mount Sinai West in Morningside here in New York City. Doctor, good morning.
Good morning.
So, I mean, so many people think about dementia and Alzheimer's. So let's first get to some good news and some of the advancements that have been made.
Yeah, you're right. I mean, a lot of people are concerned about their memory, right? And we know that Alzheimer's disease is the most common form of dementia. So really now research is focusing on several different things. Number one, how do you identify people early? So looking at imaging, maybe we might be able to see people who are at risk of Alzheimer's disease. Also blood tests or biomarkers that are specific to see, because we know that when we're able to treat somebody early, right, we can really do a lot of good. So it's important to try to identify people.
Okay.
You asked a good question before we came on, though, I thought, the difference between Alzheimer's and dementia.
Right.
A lot of people don't understand. Dementia is sort of the umbrella, right? It's a memory problem, a cognitive problem. And Alzheimer's disease falls under that umbrella. So it's the most common form of dementia that people know. So a lot of people know Alzheimer's disease, but there are a lot of different reasons why people have memory problems.
And there was a study out last week that had a link of reduced risk of dementia with some common drugs and also popular weight loss drugs, which I'm sure people will be happy to hear.
Glommed onto that, right? Because, you know, that we're looking, again, targeting Alzheimer's disease in different ways. So trying to reduce inflammation. So that's where the non-steroidals might come in. And so they're looking to see who might benefit from that. Also, the weight loss drugs, you know, we know that sometimes drugs are for one thing, but then we see an indication for other things. It might have a lot to do with treating diabetes, which also affects the brain and memory. So we're looking into that to see, you know, how that might work and if it's going to work for different people.
I mean, how do you know, for instance, you know, headaches? Yeah, we all have headaches. And we all, especially as you get older, I think you get a little bit more forgetful. How do you know if it's just normal or if it's time to see a doctor?
Well, you know, one of the most common reasons or questions people ask me is, hey, I have a headache. Should I be worried about this headache? Right. So there are certain things that, from a neurology standpoint, we're concerned about. If somebody has a headache that's sudden and abrupt, feels like your head's going to explode, the worst headache of your life, that's not normal, right? You have to go to the hospital.
Okay.
Headaches that are associated or different. You know, we all have, you said, headaches common, right? But a quality of headache that's different for you, that's not the type of headache that you've had before, that's concerning. A headache associated with a fever, stiff neck, you're confused, that might be an infection. That has to be evaluated right away. And then a headache that's associated with what we call focal neurological deficits, meaning a very specific area of the brain. Weakness on one side, speech problems, vision problems, problems walking. That might have something to do with stroke, and you have to go to the emergency room right away. And then in terms of memory, right, we all know how we are, and if we think that we're not sort of thinking appropriately. So if you really think that it's out of proportion, you should go to your doctor. There are tests that we can do, neurocognitive tests, to see if the memory's a problem. Also, a lot of different conditions have to do with memory. So if someone has a thyroid problem, if somebody has different medicines, sometimes that can cause infection again. So it's important to partner with your doctor to see, do you really have a memory problem? And if so, is it something common that can be really fixed?
What are some lifestyle changes we can make that could actually keep our brains healthy and strong?
Well, we all know exercise is important, right? And eating healthy. But, you know, one of the things is the brain doesn't like to be bored. The brain likes to be challenged, right? So to do things that are outside, you know, I'm right-handed, so many times I try to do things with my left. Learn something new, learn a challenge, learn a new language, a new dance, etc.
A new dance?
Yeah, why not? Yeah.
Like big things.
That's right. Socialize with people, right? You don't want to be isolated. And in the times of everybody's under stress, don't stress yourself out. You know, we're our worst person. I should take my own advice that, you know, sometimes you're hard on yourself. So try not to be so hard on yourself. Try to show yourself some grace. And that really will help with your brain health.
Thank you.
Thank you.
Do jigsaw puzzles help?
Puzzles of all types help. But you have to be able to do it. You have to be able to solve them.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.